Take it away, kiddo.
So I'm going to be talking about medicating primates in captivity. This summer I interned at a zoo and worked in their primate house. I was able to observe a lot of really cool medical things. Unfortunately, none of the pictures are mine since it was against the rules to take pictures. But like I was able to see a monkey get his tail amputated and like a reins go through a CT scan. So it'd be really cool to have pictures of that, but I don't. So primates are medicated basically for the same reason that your pets would be your domestic animals, for pain, sickness, or preventative measures. And the zoo I interned at had a full vet staff and hospital. They were one of the only zoos, I think, to have like a full hospital there. And all medication was administered by the vets, and everything had to go through them. So like we never had medicine just like sitting to the side that you could self-diagnose. Everything had to go through the vet office. So some of the different types of medications and supplements that the primates were on. The first one is birth control. So all the apes were on birth control, and they needed to be on it because breeding is regulated by the AZA. And if you want to have a cooperative breeding program regulated by the ACA and the SSP, you can't be breeding your animals without permission. And you can only breed when they say it's okay. And they're also on birth control so that way they don't have a baby too quickly. Apes, I think like orangutans weigh about 10 years in between having babies, so they don't want them breeding when it's inappropriate, and that could lead to issues with raising their kids. They're also on multivitamin gummies, so apes, colobus, and pygmy slow lorises would be on this. They also had vitamin C gummies, which were also for apes and pygmy slow lorises. One of the baby gorillas was on D-Visol, which is a vitamin D supplement, and that's to help with your calcium, and that's because it was a fully indoor primate house, so they never saw the sun. They would use UV lights, but this particular primate had pneumonia issues, so they wanted to make sure she got enough vitamin D. They're also on ursodiol, which some of the South American primates, such as a golden lion tamarin and calamico, were on ursodiol. And it's used to treat or reduce the symptoms of liver disease. It's a bile acid produced by the body, which is stored in your gallbladder, and it decreases the production of cholesterol, which decreases gallstones. Most South American primates have a really bad issue with liver disease, so they would give it to them for preventative measures. They were also on tramadol, which is a painkiller. So there's a swamp monkey that was on this for arthritis, and their geriatric gorilla was also on painkillers. And then amoxicillin was also used in South American primates as a preventative measure. A lot of South American primates have issues that they couldn't really diagnose, so they would just put them on amoxicillin to see if it would help with them. And then lactulose, one of the male orangutans was on this, and it's a synthetic sugar with laxative properties. It's a disaccharide consisting of glucose and fructose. Orangutans have really bad stool, so they try to give them medicine to help them regulate their system. And then the female orangutans weren't on any medication, but they would give them like Raisin Bran to help with that. And then the same male orangutan was also on Miralax, which is a laxative solution as well, that increases water in your intestine tracts to help stimulate bowel movements. Then again, a lot of the South American primates were on SAMe, which is also for liver disease, and SAMe is a molecule that is formed naturally in the body and is involved in the formation, breakdown, and activation of other chemicals such as proteins, hormones, and phospholipids. And then carvedilol is something that the male gorilla was on, which is a beta blocker that affects the heart and circulation, so it was helped to treat his heart problems. And then same with ramipril, a male orangutan was on this, which is also used to treat high blood pressure and heart failure. And then one of the things that I thought was more interesting was the ways they actually administered the medication. I don't really know what I was expecting, but just some of the things they did I thought was really creative. So the medication would either come like in pill, liquid, capsule. Some animals would take the capsule, some you'd have to take the powder out. It really just depended on the specific animal. And the keeper spent a lot of time figuring out what each individual animal needed to get their medicine. So there was a black-crested mangabey and swamp monkey that would take medication crushed in yogurt with Kool-Aid powder put in it. If you didn't put the Kool-Aid powder in it, a lot of times they wouldn't take it. They also would put like capsule pills in grapes since they're really easy to just slide in there. Gorillas would take their medication crushed in applesauce or honey, and they would spoon feed it to them, but there was one gorilla that was afraid of spoons. They're not really sure why. So they'd have to use a stalk of celery for that. The baby gorilla that had the D-Visol would take medicine and dilute orange juice or Kool-Aid since it was a liquid, so you just mix it in there. Orangutans would take vitamins as is, but gorillas, you would have to like cut out a chunk in a banana, as well as their birth control. They wouldn't take it unless it was in banana. The chewy multivitamins everyone would take as is, including the gorillas, orangutans, and pygmies philolorises. Colobus were a little bit more difficult to medicate. Their multivitamins, you had to break open a peanut and then put peanut butter in the peanut and stick the vitamin in there and then close it. And even still, they wouldn't always take it. It was kind of a hit or miss. And then South American primates were definitely the most difficult. They really only would eat bugs. They didn't like take anything in fruit or anything. So all their medication would come in a liquid form or a powder form. So the liquid you would just inject into the bugs. But like the powder, you'd have to mix it with like pear juice and then inject it. And you also had to be really careful because if you put too much in, the bug would explode. And then some of them,
and you probably did it. You probably exploded a bug.
Yeah.
Oh, by the way, before you go on, Victoria, this also works for kids. When you become parents, that same thing.
Yeah. And then with the bugs, some of them were pickier than others. So you really had to know your animals and know which one could take like 0.1 per bug and which could only take like 0.02 per bug. And then they also did training for medication. And before that, I know on Wednesday we were talking about vaccines, how everyone gets the same amount no matter your size. With them, it's kind of the same as a dog or like a people with straight medicine. It's proportionate to their weight. So for example, like a male orangutan would get 2 multivitamins, and like as humans, we'd only take 1. And then a pygmies philolorises, which they're only like this big, they get 1/8 of a multivitamin. So that was something like the vets and nutritionists calculated of how much they all needed. And then for training, there was a golden lion tamarin that was being crate trained for insulin injections because he had diabetes. And they were in the process of doing that as I was leaving, since he went from getting no injections to them wanting to inject him once a week. And then crate training is just better for an animal because it's less stressful than netting and restraining the animal. And it kind of helps to build up trust, since they want nothing to do with you if you net them and restrain them for a week, and then by that time you have to do it again. So it's a lot stressful for the animal. And then the orangutans, gorillas, and gibbons are trained to present different body parts for sedative injections. Other primates were being trained for that, but it wasn't as successful as it was in the apes. They were trained like once a month or a few times a month using a blunt needle, and then about once every month or so they would inject saline solutions to help them get used to having to hold still longer and have something go in. That'd be a little painful. And then all the animals as well were worked on being crate trained for any medical purpose or